Treatment for fatty infiltration of the liver. Your liver cells normally contain a small amount of stored fat. Non-alcoholic fatty liver disease, NAFLD, describes abnormal accumulation of fat in liver cells not caused by excessive alcohol consumption or another liver condition, such hepatitis B or C. The two types of NAFLD include non-alcoholic fatty liver, NAFL, and non-alcoholic steatohepatitis, NASH. These conditions differ in that there is no inflammation or liver cell damage with NAFLD, but both are present with NASH. Risk factors for NAFLD include type 2 diabetes, prediabetes, high blood pressure, overweight or obesity, and abnormal blood fat levels. Treatment centers primarily on lifestyle modification to improve underlying risk factors to reduce the likelihood of developing liver scarring and cirrhosis. Weight reduction. Weight reduction is a cornerstone of NAFLD treatment. A pooled analysis of 8 studies published in April 2012 in the journal Diabetologia reported that just a 7% reduction in body weight resulted in decreased liver cell fat and liver disease improvement. The authors noted that improvements increased in parallel with the percentage of weight reduction. Reducing your caloric intake helps with NAFLD because it mobilizes the stored fat in your liver cells. In addition to liver disease improvements, weight reduction in these studies was associated with improvements in markers for heart disease risk, such as levels of blood fats. This is important because people with NAFLD are at increased risk for heart disease. Approach. According to January 2018 practice guidance from the American Association for the Study of Liver Diseases, AASLD, there is insufficient evidence to recommend a specific weight reduction diet for the treatment of NAFLD. However, the guidance states that data suggest decreasing caloric intake by at least 30% or by approximately 750 to 1,000 calories daily results in reduced liver cell fat. Physical activity. The AASLD guidance for NAFLD management states that the combination of a reduced-calorie diet and moderate-intensity exercise provides the greatest opportunity for sustained weight reduction. This is likely because exercise helps increase your metabolic rate and burns calories. There is also some evidence that exercise might reduce liver cell fat even with minimal to no associated weight loss, as reported in a July 2012 Journal of Hepatology article. Medications and supplements. Pioglitazone. As of January 2018, AASLD guidance includes only one prescription medication for consideration to specifically treat NASH. Pioglitazone, Actos, was developed as type 2 diabetes medication but has been shown to improve liver inflammation and other indicators of liver damage in people with NASH. AASLD states this medication may be used to treat biopsy-proven NASH in people with or without type 2 diabetes after a discussion of potential risks and benefits. Potential risks include weight gain and bone loss in women. AASLD does not currently recommend pioglitazone for people with NAFLD. Vitamin E. An excess of free radicals, chemicals that can lead to cellular injury when present in abnormally high concentrations, is thought to contribute to liver damage in people with NASH. Vitamin E is a potent antioxidant, a substance that neutralizes free radicals. Other considerations. Visit the website. Click below.